Hello, everybody. My name is Dr. Vera Tarman, and I am an addiction physician working out of Toronto, Canada. So welcome, and I hope you find something useful. I realize I have more to say about this slide. I want to talk about denial. So I've just said to you that addiction or alcoholism is maybe 10% of society. Here's a slide behind me that shows about that. If you look here, I'm going to get out of the way, that 3 to 6%, that's what we used to call substance use and substance abuse. And now we just call it substance use disorder, which is a set of 13 criteria to determine if you're an alcoholic in this case. But actually, any substance will do. Any behavior will do also. I'm going to talk about the specifics of that in another section. But just to say here, because I want to talk about denial. So that means that, like I said, about 90% or so are not. And you know, a lot of us, when we look at these statistics, go, no, that can't be 9%, 10%. It's got to be more than that. And I actually think it probably is. The statistics, the formal statistics, even as of 2023, are still that. But I think it's wrong or not accurate because how do we know who are actually, like, any kind of research, you have to ask, where did you get the data? So who are we asking? We're not asking the family members. And besides, what do the family members know? They often don't know the extent of a person's addiction. But the point I want to make here is the person you're asking, the alcoholic, the drug user, may themselves not know what the actual, what their level of addiction is. Are they just abusing or hazardly using alcohol, drugs, or I ask a lot of people, you know, is alcohol your issue? Oh, I just use it recreationally. And then I find out, well, they've had 3 DUIs and they've already had, you know, a divorce or they've lost a job or something. I mean, that's an indication that it's more than just recreational. But the person may not actually see that because we have this phenomenon called denial. So this 67% that's over on this side here, I mean, I don't know, is that really 67% or is there actually more to it than that? Because people just don't see their own issues. Why? Because we have in the psychiatric world this phenomena. It's actually part of the exam when you walk into an emergency and you know there's some sort of mental disturbance where the physician or the nurse practitioner, whoever it is that's examining you, will say a number of questions, and they're going to be really trying to find out what is this person's level of insight. So we call this insight, right? I'm looking inside myself. And when a person doesn't have insight in the addiction world, we call that denial. So we're looking at the level of insight. And one of the things that we know is that any kind of mental disorder, whether it be depression, schizophrenia, anxiety, addiction, any of these, the person's level of insight is low. You are the most insightful when you're not in some sort of emotional disturbance. Now, what is a psychiatric disorder but some form of emotional disturbance? And some people will say that there are actual categories with neurochemically, specific categories or boundaries of them. And other people will say it's just different variations that we're just calling names to things, but it's basically essentially emotional disturbance. Our neurochemistry has gone awry. It's basically a chemical storm in there, and addiction certainly creates a chemical storm. So, you know, we've got this awareness that when people are in addiction mode, or just any kind of emotional mode, they don't really see what's going on with themselves. So think about somebody who's very angry. I'm just going to give you an example now. So, you know, that person is shouting at you, I'm telling you, you shouldn't do this. And you say to them, don't be so angry. Why are you so angry? And they'll say, I'm not angry. I'm just trying to explain something. They don't see how angry they are because they're in it and they don't see it. Your level of insight goes down the more emotional you go up, because insight is part of a higher cognitive order and emotion is a lower part of the brain, and it will dominate. Whenever lower dominates, the upper is toast. It diminishes. It's like the light goes on in one area and goes off in another, or less in another. And so you find that it's very hard to maintain insight or cognitive awareness, and especially awareness of another person. When I am mad, I don't care about you because all I care about is me. And that's not because I'm a selfish person. It's because my emotions are making me basically selfish. So I don't see when I'm in denial. I don't see when I have a problem. A person who's depressed, you can say to them, why are you depressed? Because nobody likes me, because I don't do anything right. And then you can say to them, but wait a second, I like you. So-and-so likes you. So what we see with denial and addiction is this. Basically, in the treatment center, in treatment programs across the world, people will always say, what are the lies that we tell ourselves? So there it is. The person is depressed. Everything is rotten. Nobody likes me. There's no hope. There's no point in getting up. And you might say, yeah, but you know what? People do like you. I like you. So and so likes you. You were excited about coming to this movie. Your family was coming to visit. And you were happy about that. But they don't see that, because at that moment, whatever is happening, that feels like that's the forever for them. And that's not because they're stupid. It's because that's part of the nature of emotional dysregulation. You kind of focused in on the moment, and everything is that moment forever. So that's depression. A person who's schizophrenic might actually hear things and see things that aren't there. And if you say, wait a second, I don't hear that. That's not really happening. There's nobody down in the corridor watching you or taping your phone or something like that. And you say, yes, they are. You just don't see it. You don't have the special awareness that I do, because you're in some sort of a delusional state, but you don't see that. You won't see it until you're out of the delusional state. And then you'll go, oh, that's right. Yes, when I was not taking my medication, or I was in a particular episode, yes, I was really psychotic. I saw things that weren't there, and I heard things that weren't there. But I know that they're not real now because they're not there. And similarly with addiction, you will be convinced that there's a particular reality that later, when you're not in the addicted mode anymore, you're going to go, wow, did I really believe that stuff? I can't believe it. And you don't believe it. And how do you know you're in a delusional state with addiction? Here's what we call denial. Or in other words, the lies that we tell ourselves. Denial. Don't even know that I'm lying. You don't know. So the lies that we tell ourselves. I can stop tomorrow. Yes, it's a problem, but it's not that much of a problem. It just looks bigger than it is. It's not really that much. I didn't drink that much. I just need a little bit, and then I'll stop. I'm gonna just have a little bit, and I don't need more. And basically, it's not that bad. I can stop, but I don't want to stop now. I don't want to stop now. It's not that I can. I don't want to. Tomorrow I will. These are all the lies that we tell ourselves. And there's many more. I'm just giving you the first few that come to mind. That's denial. It's the lies that we tell ourselves, and we don't see that that's happening. So when you have a statistic like this, how did we get this stuff? Because we asked people, and if they've got a drink in their hand or a drink in the back room that, as they open up the door or look at their paperwork, you don't know what status that they're at. And so my guess is it's probably more than 10%. It could well be more because of denial. We're asking the wrong person. And in fact, there's not actually anybody we could ask, because, like I said, the people around you don't know either. Everybody only knows their own truth. And the sad thing is, we don't even know our own truth, especially when we're in the middle of it, in the middle of some episode.